shell quality. So, and then with lowest mortality and lowest FCR. In broilers, we are calculating FCR by how much feed is being used for 1 kg of broiler production. Similarly, in layers, we calculate FCR of how much feed is required to produce 1 egg. Generally, we expect it less than 125 grams. Our targets are fixed for different categories of birds. So how to achieve these targets? There are 3 basic things which, if we pay attention to, we'll definitely get a very good performance from our birds, whatever type we are rearing. One is minimum stress on the birds. One of my slides will mention about the stress factors. So minimum stress on the birds. Best management. Management itself is a very big tool. There is no substitute for management. And then disease prevention. These are the 3 main things. If we can look at it, what targets we can definitely achieve. So if you look at last few decades of 3 decades or so, there has been tremendous growth of poultry globally, not only in particular part of the globe. Globally, there is a tremendous growth in poultry for last 3 decades. But during this fast growth period, certain regions have also recorded dramatic increase in the infectious diseases also. And there are so many challenges for our poultry farming. Despite these challenges, still poultry products like meat and egg, chicken meat and chicken eggs, are highest eating products, animal origin products globally. Whatever humans are eating the animal origin products, chicken meat and eggs, that holds the highest share despite all the difficult challenges we are going through. Now, poultry, as you know, poultry is the most efficient protein producing domestic species. Whatever feed ingredients we give it are not the ones which can be eaten by humans. But from that, they are giving a very fantastic quality of proteins in the form of chicken meat and eggs. And that's why highest share of animal protein consumed worldwide is by chicken. But we know that this business is, or this farming is continuously under threat of severe diseases. We know the diseases have been increasing in last 5-6 years. And this continuous threat of the infectious disease will severely affect and significantly threat economic threat to our industry, because everything depends on economics. So economics will be badly damaged because of these infectious diseases. And that's why we must to get better performance for better profitability. And now when I say economics, if you see, crores of rupees are lost every year in India as a result of poultry diseases caused by viruses, bacteria and fungi. Crores of rupees, it could be billions, I'm not very sure. So lost because the disease is there. One part is the mortality, second part is the treatment, third part is post-disease cleaning. So all these things will require huge amount of money. So crores of rupees are lost every year until even despite using prolific use, that means abundant use of best available and vaccines, best available antibiotics, microbial diseases still remain a great threat to the poultry industry. So, and why that? One of the reasons is heavy bioburden. Everybody knows what is bioburden. Presence of disease-causing organisms in the shed, maybe bacteria, maybe fungi, maybe viruses. So all these are called as bioburden. So one of the major contributing factors are unacceptably high levels of pathogenic microorganisms, which are carried over from one batch to the next. Now we are going to discuss about biosecurity in the next part of the presentation. But this point you must remember when we are thinking of biosecurity. These organisms are carried over from one batch to next unless we follow good biosecurity. And then once the population of these microorganisms, it crosses acceptable levels, then even the birds are immunized, the vaccinated birds are having good immunity, still they will break through the immunity because of heavy bioburden. And that's why keeping this bioburden low is our main target of biosecurity. So here the role of biosecurity comes into picture. This is major tool to reduce the bioburden in the poultry houses. How it is achieved, we'll see in the next slides. Now, when we think of respiratory diseases, with the advent of industrialized poultry farming, newer and newer challenges are apparent on the disease front. Now, the main reason is the intensive rearing systems. Because of intensive rearing methods of the poultry, they are responsible for making increase in the respiratory diseases worldwide. Now we are thinking worldwide, not only India, and they are becoming increasingly apparent in different parts of the world. Now, besides this infection, there are certain factors or causes which are called as predisposing causes. Veterinarians know what is predisposing causes. For non-vets, I'll tell you, there are certain conditions which will make the disease-causing organisms favorable condition to produce the disease. So dampness, that is more moisture or more humidity in the sheds, poor air exchange. In case of poultry, whether it is broiler or layer of breeder, ventilation is paramount importance because our system, broiler, birds' respiratory system is different. So if the ventilation is not good, there will be poor air exchange, putting a lot of ammonia in the shed, putting a lot of pressure on the respiratory tract. Overcrowding, naturally it will lead to more stress. Sudden changes of temperature, even though the temperatures are going on increasing slowly, the birds can adapt. But when there is sudden temperature, either increase or decrease, the birds cannot cope up. Like today it is 35 and tomorrow it becomes 40, the birds will not be able to cope up with that. But if it slowly increases from 35 to 36, next day 37 and so, they will adapt. Same way for the cold season also. But sudden temperature will be one of the major predisposing cause, and very dirty or filthy litter also be a cause of respiratory disease. Now, what are the common signs of respiratory diseases in chicken? This is not for any specific disease. These are general respiratory signs exhibited by the chickens undergoing respiratory diseases. One is sneezing. Second is open mouth breathing, something like gasping. Then wheezy or gurgling sound while they are breathing. Ruffled feathers. The feathers coats we are expecting very smooth and shining. That it may be ruffled one. Then around nostrils and eyes, you can see discharges, like in especially coryza, you can see that discharge around nostrils and eyes, and head shaking. They try to shake heads continuously. So these are certain common signs of respiratory diseases. Now I said about how to achieve targets. I had said minimum stress. Now there are so many factors. They can put stress on the birds. What are those factors? Presence of viral and mycoplasmal challenge. This is most important stress. However precautions we take, the presence of these will be there. Only thing, we try to keep them under control, keep them low, and make the birds immune so that they will not play their role. Bird handling and transport. That has to be done many times. For vaccinating, we have to handle the birds. For weighing, we have to handle the birds. For thinning, you have to handle the birds. For shifting from grower to grower to layer, you have to handle the birds. Transportation may be from growing site to layer site, maybe 3, 4, 5 kilometers, or sometimes people purchase grown-ups from 200-300 kilometer away place and put it in the sheds. So bird handling and transport is another stress factor. Weather changes, as I told just in earlier slide, I told you. Diet changes. This doesn't mean diet of one company changing to other company. Diet from pre-starter to starter, starter to finisher, or in layers, breeders to close to pre-layer, pre-layer to layer. These diet changes are also factor causing stress on the birds. Some lacunae, some deficiency in the management, because management, I said, is very important tool, and management, there is no substitute for good management. Then routine vaccination. Even though it is a routine vaccination, it is a stress factor, even though it's not by handling the birds, because people think that giving water vaccination will not put stress on the birds. That is not the case. Even through drinking water, when you give the vaccine, the internal immune system has to gear up to produce the antibodies, and it puts a lot of stress on the birds. So routine vaccination also is a stress factor. And because of any of the stress factors or a combination of them, what is result is immunosuppression. And whenever there is immunosuppression, the vaccines won't give you good immunity, or the immunity produced is not sufficient, and the birds will undergo a disease outbreak. Now we go to the main topic, that is avian influenza. Our main topic today is avian influenza. Now this AI is also a respiratory disease, so I have taken this respiratory part in the beginning. Now let's discuss what the disease is, why it is so important, and the ways to prevent the disease. Although it's a disease of chicken, recent news are very serious concern because they are seen in the mammals also. Now, this avian influenza, if you are going through journals or articles, in America, last 1 year or so, there have been so many outbreaks of avian influenza that they have to destroy or cull a large population of laying birds. And there is acute shortage of eggs in the US, and there is rationing of eggs. A person can get only a particular number of eggs, not more than that. Even I heard yesterday, or read yesterday, that for Easter also, Easter is coming very close now, they don't have the eggs. They are dying the potatoes like eggs. So that is the situation there, because some crores of birds they had to kill because of avian influenza. And that's why it's a very, very important topic worldwide, not only in India. Now, as I said, what is the disturbing news? Only last week, there is a periodical called Pashu Sandesh. It has highlighted the fact that the AI virus has jumped the species. That means other than chicken, it has gone to other species and has been found to be a cause of disease in birds other than chicken. Not only here, when we say poultry, we are referring to chicken, but poultry is not only chicken. The ducks and turkeys and quails, everything comes under poultry. But other than chicken, they have jumped, and also in the mammals. That is more serious concern. In the mammals like tigers, leopards, jungle cats, pet cats. So there is unprecedented spread of H5N1 virus across the species, not only chicken. And that is a more worrisome situation. In Maharashtra alone, the virus has affected tigers, leopards, vultures, crows, hawks, and egrets. In Madhya Pradesh, it has reported a pet cat positive for the virus. In Rajasthan, Demoisile cranes and Pente storks have fallen ill. So the situation has reached a very critical juncture now. And we must be ready to fight and win the battle against avian influenza. And that is our topic, how to win the battle. Now, a little history of that. Basically, it was disease occurred almost 150 years back, 147 years back in Italy. It is still there and it is more and more spreading, just like ND. ND is also next year, it will be 100 years. 1926, ND was first reported. Now it is 2026, we are reaching 100 years. Here it is almost 150 years. The disease is still on and it is increasing the power. And it's worldwide distribution. As I said, it's not restricted to only India or only Maharashtra or only Pune or only Mumbai. It's worldwide distribution. Basically, it's coming from the reservoirs like free-flying aquatic birds, ducks, geese, migratory birds. We know migratory birds. I need not tell in details because whenever avian influenza is discussed, this migratory birds' role is always discussed. And then the outbreaks are worldwide, not restricted to any particular continent or any particular area. It's there worldwide, spread by aerosol, that is aerial spray, shared drinking water, and fomites. Fomites is non-living objects like shoes and some other non-living objects. They can carry the virus. It is found in the respiratory secretions and feces. That is whenever they, as I said, there are respiratory discharges, maybe from nostrils, maybe from eyes. So they will contain a large amount of viruses. Similarly, in the droppings or feces, you see large concentration of viruses. And incubation period is 3 to 14 days. Why I have put it in the red color is when we are going to discuss about biosecurity protocols or cleaning protocol, this part is important. What happens is if the disease is under incubation, if I go to the farm, I don't know that disease is there because it is in the incubation. What is incubation? The virus has entered the birds, but the signs are not apparent so far. So it is not a clinical disease so far. So what I feel, the flock is clean. And if I go from this flock to other flock, I am unknowingly carrying the virus with me because the flock is already infected, although it is not showing the signs. So whenever I go to any farm, I must consider every farm as potentially infected farm. And I must follow the rigid protocol of biosecurity when I'm visiting other farm. So every one of you, either you are a farmer or a vet, you must remember this thing that every farm you are visiting is a potentially infected farm, maybe by AI, maybe by any other disease. Now, this AI is clinically indistinguishable from virulent Newcastle disease because we are seeing virulent outbreaks of ND also, where the mortalities are 30%, 40% also. So it is practically clinically indistinguishable from virulent form of Newcastle disease. But if you see severe depression, inappetence, that is loss of appetite, drastic drop in egg production, followed by sudden death in the flock, you can always suspect it could be AI. Of course, the confirmation can be done by laboratory. It's very difficult to 100% give the diagnosis of AI at the farm. we can just give tentative diagnosis of AI, but it is not very easy to give conclusive diagnosis from these signs. Now, what are the clinical symptoms of AI? Again, similar things are there, like what I have described in general things. Depression. The birds are not active. They will be depressed, sitting at one place, reluctant to move. Anorexia, that is loss of appetite. They are not interested in the feed, even though it is there in front of them. Ruffled feathers, the same picture I told you, they should have smooth, shining coat. It is not there. Combs are swollen. What if the birds are grown enough? If they are not just growers, if they are layers or big birds, the combs are full grown. So they will be swollen and cyanotic. That is bluish colored. I will show the photographs. Conjunctivitis and respiratory signs. Conjunctivitis is reddening of eye, some discharges from eye, and the respiratory signs, what I described just now. Now, what are the gross post-mortem lesions? Whenever there is mortality, we vets go and open the birds to find out if we can get some clue about probable cause of the mortality. So the lesions of low pathogenic AI virus in chickens vary depending on host, that is whether it's a broiler or layer or breeder, and other factors like age at the infection, immune status of the host, whether it is immunized against IETB, AI, or overall how much it is immune. Then virus isolate, what type of virus it is affecting the bird, route of exposure, and then presence of secondary bacterial or viral infections. So it will depend on these factors, what will be the gross postmortem lesions. But in general, they are similar in most of the cases. Now, this is a normal trachea or windpipe of chicken. Should be white, slightly moist, no red color. That should be a perfectly normal trachea of chicken. So unless you see this trachea, you cannot call it normal. Then after some time, it becomes slightly red. We call it congested. And in this case of AI, there is hemorrhage inside. You can see the dark blood overall here, blood in the trachea, post red color. So this is a hemorrhagic tracheitis. So this is the first inclination towards diagnosis of AI. You can see it is very typical. Generally, ILT also you see the hemorrhagic tracheitis, but it's slightly different. There are many blood clots in that, and the color is also slightly different in ILT. Then I told you swollen and cyanotic combs. The wattle, you can see this full-grown bird. Wattle is also swollen and cyanotic dark blue color, and the comb, fully grown comb, that is also dark red and swollen. And this is a depressed bird, depression of the bird. I told you the birds are depressed. Then this is a very typical picture which can generally give you diagnosis of AI grossly. The shank region of the birds, unfeathered part of the legs, and this paw region, you can see there is hemorrhage, this red color. Normally in birds, you will not see this red color. This is all yellow color normally or brownish color. Here you can see this hemorrhage right from here to here. So these swollen shanks and hemorrhage, this is generally an indication of AI. You can see it males, females, everywhere will see the similar picture. Then a plug at bronchotracheal junction. Whenever you open the bird, the trachea is the windpipe. When it goes in the body cavity, it splits into two branches. Those are known as bronchi. So the junction where the trachea divides into bronchi, this junction is known as a tracheobronchial junction. So here at this point, this trachea is coming here, and then this is junction going to two lungs. So here white one, what you see here is the plug. And because of this plug, the complete respiratory tract will be blocked and bird will die of suffocation because respiration is not possible here. So this is one of the signs. Then one more sign is around the heart. There is a fat on the upper part of heart. This pericardial fat we call it. So sorry, epicardial fat. So the epicardial fat, you can see the red dots of blood. That is called as petechial hemorrhages. So these hemorrhages, can you see here? This all where you can see all those red color in the epicardial fat. So this could also be a typical lesion of avian influenza. And then egg peritonitis. You see two types of egg peritonitis. I have given you two pictures over here. One on the left side shows you a different picture. One on the right side, different. Both are called as egg peritonitis. Here you see much solid mass looking like the egg yolk, boiled egg yolks or boiled yolk whites also. But here you see a more of a liquid, curry-like liquid over here. So this is generally of viral origin, and the left one is generally of E. coli or bacterial origin. So please don't get confused. This peritonitis is not viral generally. This is generally indicating viral origin, and mostly in AI cases, you can see this type of picture. Now what happens is, if the AI comes alone, it's a different story. If there is a co-infection of some respiratory avian pathogens, it's a different picture. So now what happens is, this intensive rearing methods of poultry, what we are doing, are responsible for marked increase in avian respiratory diseases. That I said in the beginning, because of intensive rearing system. Now, when there is interaction between AI virus with other pathogens, what is the list I will show in the next slide. So if there is interaction between AI virus and other pathogens, you can guarantee that there will be continuous existence of other pathogens in the farm. So if there are other pathogens coming with AI, the other pathogens will be permanently present in the farm, and that's a global concern. Again, not restricted to any geographical area of the globe. Now, co-infection of AI viruses and a bacterial pathogen can worsen the course of the viral or bacterial disease, because only AI may not cause that much problem. But if it is with bacterial pathogen or viral pathogen, it will worsen the course of the disease and this condition will be grave. Now, mixed infection of low pathogenic or high pathogenic AI virus in association with other diseases are reported. These are some of the diseases. One thing is, it may be with ND and IB, or with ND alone or with IB alone. Both are respiratory viruses. Again, Mycoplasma gallisepticum or Mycoplasma synovi or CRD organisms, they are also respiratory pathogens. ORT, Ornithobacterium tracheae, that is also respiratory. Besides these, E. coli, which is omnipresent, it's like a God. God is omnipresent. So E. coli also omnipresent. No farm is free of coli. Only thing, we see more cleanliness so that E. coli cannot take upper hand. E. coli are called as secondary or opportunistic bacteria because they need some break in immunity or some stress so that they can take upper hand. So we try to see that these stress factors are minimized, and even staphylococci. So these pathogens, if they are having mixed infection with LP or HP AI virus, then the condition will be very grave. Now, if you think of treatment of AI being a virus, there is no treatment for the virus. Everybody knows, even in humans, there is no treatment for any virus infection. Like jaundice, like herpes virus, you get that infection around your neck and stomach and all those things. So in case of viral infection, in any species, there is no treatment as such. What we do is try to reduce the severity and reduce the secondary complications. That is the target. So supportive care, what is supportive care? You can give electrolytes, you can give multivitamins, we can give liver tonics so that their energy is maintained and they are more active. And many times, as we said in earlier slide, some other bacterial or that type of infection is also accompanying that, which is causing secondary problems. So we can give some antibiotic which will treat the secondary infections. So supportive treatment and antibiotics, that is one part. Second part is to reduce the bioburden in the shed. Now shed is already infected, but still we'll try to reduce the bioburden or the burden of the virus in the shed. And how we'll do that? That will, of course, by using antiviral product. You get many antiviral products in the market now, Indian market. So we'll use them to contain or reduce the mortality. And the most important in such cases, even in Gamboro and all other viral infections, the products containing the triple salts of potassium, these are the main products which will work in the presence of organic matter. Because these viruses, if they are covered under organic matter like droppings or feathers, they will be safe even if you spray the antivirals. But now these antivirals, triple salts of potassium, they can work in the presence of organic matter also. So these type of products like Chem Raksha 49 from Chembond Biosciences, that is also a good product having triple salt of potassium. And this can be used as a spray as well as to drinking water. I think Dr. Sanjay or somebody from Chembond can tell about the dosage and other things. But this is one of the products which can be used for reducing the mortality by reducing the viral load in the shed. This can be used as spray as well as through drinking water. Now, what precautions are to be taken for spray, that I will tell you in the next part of the presentation. That was part of treatment. Now we want to prevent the AI. We don't want AI to affect our farm. So no question of treatment. We want to prevent. Now, what are the ways wherein we can prevent AI? The most important keyword is strict biosecurity. Now, biosecurity is easy to be said, but difficult to be done. Because whatever biosecurity we discuss in the offices or in the seminars or webinars, even 25% of it is followed at the farm, many problems will be solved. But it's my practical observation. Some farms are good, but hardly 5% of what we tell to the farmers are followed. Others are not following it. So that is the main reason of increasing in the biosecurity. Now, today I was reading the article about AI in the US. They said that they have started strict biosecurity and the effect of AI is slowly fading away. So biosecurity and vaccination, these are two important tools. Only biosecurity will not help. You have to go for vaccination also, and then you can feel that you are covered from both the sides as far as prevention part is concerned. Now, this preventive vaccination is done only with the inactivated or killed vaccine. Earlier, some country had tried live vaccine, but there were so many complications in humans as well as in birds that they stopped it. So worldwide now what they use is inactivated vaccine. So far, we have got permission for low pathogenic AI vaccine in India. Only last year only, I think 4 months back, we got the permission. Rather, permission was given some 7-8 months back. The vaccines have come to market with official label now, around 4 months back. So we can use those vaccines. The schedule will be decided by the companies or our vets visiting the farm. They can decide. But a general schedule for layers and breeders is first dose is around 6th week and second dose is around 17th week. That is a general schedule for layers and breeders. And of course, mid-lay is also required sometimes. But it is inactivated vaccine. And please remember, in India, it's only low pathogenic AI vaccine. Even HPI is not freely allowed in US also. Only recently they have allowed US Zoetis to use HPI with controlled conditions, not for commercial broilers. So HPAI, our fraternity is also trying to plead to government to allow HPI vaccine. So far, they have not, because there are so many other complications of surveillance and all those things. But we have low pathogenic vaccine. We can use it, and definitely it will give you good protection. Then second factor, when we are thinking of preventive vaccination, we must give a very strong immunity against ND also. Many times, both these things come together, AI as well as ND. And that's why sometimes ND may be causing more damage than AI virus. And that's why you should have very strong immunity against ND also, so that that part is also covered and AI also you cover. So the losses will be minimum, if at all the disease strikes. And most important is no use of Lasota strain of vaccine. You can use the clone vaccines or other strains, but no Lasota. For ND live vaccine, you should avoid Lasota. I have been avoiding Lasota in my prescriptions for last almost 20 years. Now, this is not a joke. In 2004, the AI was there in Indore. Of course, it was not officially declared, but wherever Lasota was used, then there was a lot of problem. And probably few of you have heard of name of a very senior veterinary pathologist, Dr. Jail Vegad. He is now 85 years old. So he was in Indore, and then he has studied why the problem was more in Lasota vaccinated flocks. And then he found out that there is some interaction between Lasota strain and A virus. Actually, technically, they are different viruses. One is orthomyxovirus, one is paramyxovirus. But if you go to more strict scientific language, both are single-stranded negative sense RNA viruses, and there is some cross reaction, and rather than antigen, it acts as a pathogen, and you get the complications. So no use of Lasota wherever you see the threat of LPA or HPI. And I think it is now countrywide presence. So try to stop Lasota and go for a clone vaccine. Now, biosecurity. When we see biosecurity, it is always inconvenient. Everybody feels that it is inconvenient, not easy to follow. As I said, it is easy to speak, difficult to follow. Now, what is coming under biosecurity? One is cleaning and disinfection of sheds. I will come to this in the next slide again. because that is very important step to start the flock. Control on movement of people and material. So nobody should enter your shed, not you should get to other shed. If at all you have to go, you have to go with the protocol. That is, you have to dip your foot, you have to remove your footwear, cover, use the footwear put at the farm, then spray yourself and then go inside. That you can do. Even if you want to get some material in the shed, it has to be sprayed with a good viruside, and then you can take inside. Then regular spray of disinfectants, that I'm coming again in the next slide. Proper disposal of dead birds. If you don't dispose of dead birds properly, they will become source of infection to adjacent farms, because crows and dogs and cats, they will carry it to other area. And rodent control, because whenever there is poultry, there is rat or rodents. So rodent control, because they also spread diseases. So these are, yes.
सर ये डिसइंफेक्टेंट्स जो 3 वे आप बता रहे हैं पिलाने के, तो ये बर्ड्स को अपन पिलाते हैं तो उसका साइड इफेक्ट भी तो आता है?
नहीं कुछ
मोर्टेलिटी
नहीं,
उल्टा बढ़ता है उससे?
नहीं, I'll tell you later. I'm coming to that next point.
Sir, 1
Now,
minute.
yes.
My request to all the participants, we planned a query and answering session. So after this webinar, we'll discuss on your queries. So don't disturb the keynote speaker. Please, sir, continue.
Organizers can mute the mics of all, and then you can unmute at the end. That you can do. So we are discussing about cleaning and disinfection of shed. That was my first point under biosecurity. Now, as I said, every shed I consider as a potentially infected shed. Now, sometimes, especially in case of layers, what happens is, in case of brooding, you keep it in the brooding shed for about 8 weeks and then transfer to grower shed. Many times there is no significant disease in the brooding stage, so you feel there is no disease challenge as such. Let me clean just superficial. But that is not the case, because there are certain viruses and bacteria which can cause problem in the chicks, but they don't cause problem in the slightly grown up birds. So the viruses and bacteria which could cause harm in the first 2 weeks may not cause harm in the 6th or 7th week if they enter the shed. But that means that they could be there in the sheds. So very thorough cleaning and disinfection of the sheds has to be done before the chicks are placed. That is very important. And proper cleaning is most important before disinfection. Proper cleaning removes 80% of the germs. If the proper cleaning is not done, the good disinfectants are also rendered useless. That I have seen many times. This triple salt of potassium also, it's really a fantastic product. But if the cleaning is not done properly, the organic matter is remaining in large amount, then it may not work. So cleaning is most important. Then in case of disinfection, there are two terms used. One is known as a terminal disinfection. Other is known as a continuous disinfection. Now, what is terminal disinfection? Cleaning and disinfection before placement of birds is called as a terminal disinfection, wherein you use stronger dose of chemicals, rather overall strong procedures. But in case of presence of birds, it's called as a continuous disinfection. So in my earlier slide, I said frequent disinfectant sprays. Now that presence of spray in the presence of birds is known as a continuous disinfection, and terminal is at the end of the cycle. So please remember these two terms. Now use of disinfectant is to be done. And now what are the criteria to be seen in the disinfectant? It should work in the presence of organic matter. It should be non-toxic at recommended dilution, and it should be able to use in presence of birds. So same thing, Chemraksha 49, what I said, that can be used. Now, in case of this disinfection, whether it's a terminal or continuous, the most important point is quantity of water to be used for disinfecting the premises. I have seen that quantity of water is invariably low than what is to be used. Now, when I tell terminal disinfection, for every 1,000 square feet area of the shed, I recommend 40 liters of water, 40. That means if my shed is 5,000 square feet, I will need 200 liters of water. Generally, this much is not used. Same thing in the presence of birds. You have to use 8 liters of water for every 1,000 square foot. Like for empty shed, I said 40 liters. This is only 20% of it. 8 liters water for every 1,000 square foot. Now the quantity of your disinfectant will change. But if you say 5 ml per liter or 5 grams per liter, then if your water quantity is less, proportionately your disinfectant will also go less. Now, in my example, earlier example, when I say for 5,000 square feet, you need 200 liters of water. If you take only 100 liters, naturally you will put only 500 grams of disinfectant, whereas you will have to use actually 1 kg. So water quantity is very important. Many times, even in presence of birds, whenever I see the disease, I ask them to spray the disinfectant. So for 5,000 square foot, they have to use 40 liters in the presence of birds, 8 liters for 1,000 square foot. But I see that with one knapsack of 15 liters, they complete the shed. So that is not the way. You have to use the required quantity of water. Then and then only the proportionately correct quantity of disinfectant will come in the water. Then you have to make a spray. So while spraying in the presence of birds, you have to direct the nozzle towards roof. And while in the empty shed, you have to drench wet the surfaces. Practically drench wet. पानी टपकना चाहिए हर जगह से. That wet drenching has to be done in case of empty sheds. So please remember, even if you go for Chem Raksha 49 or any other product, you have to keep it this in mind that unless you use the proper quantity of water, the disinfection won't be good. Now, this is just a foot bath or foot dip. Sorry, foot dip I had seen in Vijayawada. I liked it because what happens is when you put your foot with dust inside, the efficacy of the disinfectant vastly diminishes. Here it is a twin foot bath. If you put the foot here in the plain water, it will remove the dust. Then you put in the disinfected water and then go inside. So its efficacy will be maintained. So that way it has to be used. And this is when you go inside, you either have this knapsack type of pump has to be there or this small sprayer, so that when you go inside, you have to spray around you, just from neck below, you have to spray all around you and then go inside. So these are very important points of biosecurity that you need to use. Now, as far as this drinking water was concerned, somebody asked about the question, I will answer again. But whatever is recommended dose by the company, if you follow that critically, the birds will not die. If they are dying, there is some mistake. Either the quantity is wrong or calculation itself is wrong or some other factor has come into play other than disinfectant. Because actually the first one which came in India, this type of product was Vercones, which came during IBD outbreak in 1994. So from 94, for 31 years, I'm using it without any problem in the birds. So other part is quality of drinking water. When we speak of biosecurity, the part of drinking water is also biosecurity because some infections are coming through water, especially E. coli. Now, unfortunately, as the modern bird has become more and more efficient for growth, production, and feed conversion. Because I remember when I entered the poultry career almost 40 years back. In the next month, I will complete 40 years in poultry. So May 85, when I joined my first assignment as a poultry pathologist, then it used to take 63 days for attaining 2 kg body weight. Now you get in 33 days. So that is there. Then eggs, that time 280 eggs for layers was very good, fantastic performance. Today it is 332 in 72 weeks. So that type of thing. Then earlier FCR in the broilers 2.2, 2.3 was fantastic. Now nobody wants to go beyond 1.4, 1.5. So there has been tremendous genetic improvement. So efficiency is there in growth, production, feed conversion, but it has become less and less tolerant to stressor factors, and most significant being poor water quality. You must have noticed earlier, like in broilers, there was one Cobb 100, which was slow growing, but absolutely resistant to all the infections. Now this Cobb 430Y, you know how it is sensitive to all the issues. With Marne things also, it starts dying. So as more and more efficiency is there in growth, production, and FCR, they are more and more less tolerant to stressor being poor. Now, what would have been absolutely no problem for birds 15 years ago could be devastating of the birds for today. 15 years back, if there was some insult in the management, some insult in the vaccination, some insult in the feed, the birds would not have suffered that much. But today, if similar mistake is done after 15, 20 years, it could be devastating for today. So drinking water, and unfortunately, we don't take it as a precious commodity because it's either free or much less amount has to be paid as compared to other inputs. So we don't pay much attention, but drinking water quality is utmost important as far as performance is concerned and as far as biosecurity is also concerned. So drinking water, it is a part of biosecurity, and for that, two factors we always check: pH of water and bacterial contamination of water. Now, bacterial contamination, I always recommend to the farmers to get the water tested in a good lab at least thrice a year when the seasons change. From summer to monsoon, maybe in the June, July, whatever the monsoon starts in your area. That is one time. Second is monsoon to winter, maybe November, and then again winter to summer, maybe in February, March. So when at these three stages, you can get the water tested in a well-reputed laboratory for a test called as MPN, most probable number. So MPN test will give you the idea of how many coliforms are there. And then depending on that, you have to use the water sanitizer. Second is the pH. We need alkaline, we don't need alkaline pH. Alkaline pH is good for bacteria to grow. So we want the pH to be acidic, less than 7 pH, maybe 6.6 or so. So if it is high, you have to acidify. So again, there are two good products from Chembond. One is bromogreen, which is bromine of different type for sanitation. That is for removing the, or rather killing the bacterial load. And second is for acidification, chemocid PHP, that can be used for acidification. In sanitation, there is one more point because we are speaking of biosecurity. So our sanitation is targeted at killing the bacteria in the water. Now, this dose of the company, whatever company gives dose. Now, for example, this bromogreen, they recommend 10 grams for 1000 liters. Then there may be some products 1 gram for 1 ml for 10 liters or 1 gram for 10 liters. Whatever dose recommended by the company is considering a specific amount of bacteria, maybe 500 or so. In laboratory, this MPN test, we can calculate bacteria up to maximum 1800. It could be going beyond that also. So if your water is having very high count of MPN, maybe 1500, 1600, then this 1 gram of bromogreen of 1 gram, 1 ml of some other product may not be sufficient. You may have to increase the dose. So depending on your quality of water, you have to increase the dose of sanitizer, you have to increase dose of acidifier. So once if you can confirm the pH and bacterial count, then you can decide the dose, and then proper mixing is very important. That way you can get rid of bacteria, and it's a part of biosecurity. So to summarize what I've said, avian influenza, that is AI or bird flu. Now we have started seeing bird flu. So far, people were afraid of bird flu. In southern part of India, right from MP, center and southern, we used to say VVND, and the upper part north, they used to say variant. Now we are openly saying bird flu. So avian influenza or bird flu is definitely a matter of concern, not only to poultry farmers, but also to public in general. Because in India also, there is one fatality, one child has died of bird flu in Karnataka. And again, as I said, in Madhya Pradesh, that pet cat is found positive. So it's public in general, for public also, it's important, not only our poultry farmers. But the positive side is the disease can be prevented with stringent biosecurity and preventive vaccination against the disease. Stringent biosecurity is the most important, as I said, that is the key word. So we have to keep a very close eye on biosecurity. For well-organized farms, you should plan out complete biosecurity protocol. It should be easy to follow. Otherwise, if you make a very complicated program, the person who is actually carrying out the program at the farm will find it difficult. So it should be very easy to implement and should be effective for prevention of all the infections. And of course, we have to make the bird immune. One thing is by preventive vaccination, and again by putting minimum stress on the birds and a good feed, having all the balanced in nutrients. Like we say Chyawanprash in the humans. What does it make? Chyawanprash is mainly vitamin C. 48% of it is amla, Indian gooseberry. So that will give a good immunity against overall general immunity. So if you just get wet in the rains, you will not start sneezing or coughing immediately because you are having immune. So that type of immunity we have to produce in the birds, plus vaccination. Now vaccination is again a big topic, but you should consult the local veterinarians because vaccination schedule is not a blanket policy. Area to area it changes. So consult your local vet and design the vaccination schedule and implement it whatever said. And the disinfectant products, they must be used as per the recommendation of the manufacturer. Please see that whatever is recommendation you have to follow. थोड़ा महंगा है, थोड़ा कम डालता हो, ज़्यादा है डालता हो, that thing not to be done. If they say 5 grams, you have to do 5 grams, not 4 grams. So that way you can do the disinfection with proper protocol. and fantastically you can go for that. So thank you very much for your kind attention. I'll stop the presentation. Now you can ask the questions. Of course, Dr. Sanjay,
Yes, sir.
over to you.
Yeah. Sir, thank you for this insightful information. I request all the participants, please share your questions in our chat box. So after 5 minutes, we'll give you time of 5 minutes. After 5 minutes, we'll share these questions with Dr. Sudheer Rukadikar and they will answer us. Thank you so much. Just I will give you 5 minutes. Meanwhile, I will go through our company presentation and product offerings in biosecurity segment. Yeah, this is regarding Chembond. We founded this Chembond company in 1975 by Dr. Vinod Shah. Now currently this company is listed in both BSc and NSE stock market. So overall, we have employees about 300 plus and group revenue is of 250 crores. So we have diversified portfolio and Chembond initiated operations with pre-treatment chemicals in 1975 and company expanded into water treatment chemicals in 1980 and emerged as the market leaders in industrial water treatment chemicals. So we had established a joint venture with Henkel for pre-treatment chemicals in 1917, successfully exited in 2015, and after that, the Chembond entered in animal health and nutrition business in 2010. So they strengthened portfolio through strategic acquisitions and now the Chembond is into animal health as well. And in animal health, we have different types of product offerings that too in feed additives, feed supplements, and in feed supplements, we have uh, different category products that caters the needs of poultry farmers. We have our own R&D units. This is our product category, and we do have our own manufacturing for probiotic, prebiotics, and enzymes. Also, we have the products that caters biosecurity and farm management. And as I rightly said previously, that we have some products in feed additives like acidifiers, toxin binders, non-antibiotic growth promoters. Then into vitamins and minerals as well, we have the individual vitamins, blend of vitamins, individual minerals, and a blend of minerals as well. So these are our manufacturing facilities. We have our own manufacturing facilities at Alandi, Maharashtra, Dudhwada, Gujarat, then Tarapur, Maharashtra, and Mahape as well as in Mahape as well. So we have a presence in more than overall India, and we have 100 plus dedicated sales team which provides technical service to customers and sales support to the customers. We have our own laboratory setups for technical services in terms of feed and water analysis. We got certification for our facilities. This is about our farm biosecurity offerings. For terminal disinfectants, we have Chemraksha Plus, which contains glutaraldehyde plus quaternary ammonium compounds, which is effective in wide range of pH and active in presence of organic matter. With Chemraksha Plus is largely used for broad spectrum farm and hatchery disinfectant, which is utilized under terminal disinfectant programs. We have continuous disinfectant, that is Chemraksha 49. It's a blend of triple salt and sodium chloride. It destroys wide range of bacteria, viruses, and fungi. and it's a well-known and highly effective, easy and convenient for use. Under water sanitizers, we have Bromogran. We have more than 250 farm demonstration trial reports for these products, and many of the well-known integrators, they are using these products for water sanitation. Before and after application, after application there is a nil count of E. coli, and it is largely used for E. coli and total bacterial count, to reduce the E. coli and total bacterial count. And it is active in wide range of pH. So product have so many benefits for underwater sanitation. Up to last drop of the water, it provides sanitizing effect. For mycoplasma, we have a blend of essential oil, and it mainly contains eucalyptus, which helps to mitigate the secondary symptoms of respiratory tract infections like mycoplasma and other infections as well. And naturally, it restores the respiratory functions. Under acidification, water acidification, we have chemostat PHB, which maintains pH and it considered as an ideal water and acidifier for poultry drinking water. So if you have any inquiry related to the sales, we have our zonal managers for different zones, and we have our technical team as well with us. You can contact us whenever you have the requirement of products. So now I love to share your queries with Dr. Sudheer Rukadikar. And share with us. Sir, there is one question from Dr. Rahul, that
Yeah.
why respiratory diseases are more common in broilers. Can you address?
Yes, we'll try to address. Basically, broiler among poultry farms, whatever we are using poultry species, broiler is the fastest growing bird. We know in case of breeders, we are restricting the growth, but otherwise, broiler are the fastest growing birds. Their metabolisms are very fast, and that's why their respiratory system is continuously under stress. We know that the respiratory system in the broilers, or rather chickens, is throughout the body, not only restricted to the upper part. Like in humans, it's a chest and abdomen. It's not the case in case of broilers. So naturally, they are continuously exposed with the incoming air. They are always exposed to these pathogens. In many broiler farms, what I've seen is the ventilation is not good, or the litter quality is not good. And whenever the litter quality is not good or ventilation is poor, there is always ammonia. Actually, ammonia, if you feel ammonia, it's very high concentration. But for birds, even 25 ppm ammonia is also dangerous. When we smell it with our nose, it is almost more than 50 ppm. So there is ammonia whenever litter quality is not good. And this ammonia is the major factor causing reduction in the resistance against respiratory pathogens in broilers. Because this this ammonia plus water in the trachea, it will cause very thick mucus because it produces ammonium hydroxide, NH4AH. And that's why it becomes, the first line of defense becomes useless, and the bacteria or viruses, they can go into the deeper part of the body and they produce the disease. So it is more there in the broilers. If the ventilation is good and the litter is kept dry, generally the problems are not that high in broilers.
Sir, thank you. Sir, I have received one query on my WhatsApp. So is Dr. Vijay, he want to know how often is litter changed or treated?
In case of what? Broilers or layers or breeders?
Layers, sir.
See, layer, what we do is, if your shade is good enough, once in a year you can remove the litter once the flock is gone. If the shades are low, the height below platforms is low, you may have to remove as and when it accumulates. Generally, if the height is good, below platform, the height is more than 5 feet, one entire cycle of the flock can go without removing the litter. Otherwise, it is not necessary to remove it unless it is touching to the your walking surface.
Okay, so there is one question from Mr. Senthil, is a farm supervisor in Tamil Nadu. He's asking that how can we restrict the movements of birds, equipments, and vehicles? Can you throw some lights on this?
Now, when I say restricted, that means unnecessarily they should not visit the farm. Restriction is unnecessary movement. Now, when you want to get the feed, when you want to get the birds, the vehicles need to come to the farm. Or when the supervisor has to come, the doctor has to come, they have to come. But they should follow the protocol then. If I don't need to go to the farm, somebody's farm, I should not go. I try to restrict myself from going to that farm. That is the restriction. But if I must go, I must change my shoes, put the rubber slippers at the farm, put my feet in the food dip for 30 seconds, then go inside, spray on my body below my neck. Then I should go inside. So that is the main restriction. Similar is the case with the non-living material, maybe feed, maybe instrument equipment. For feed vehicle also you have to spray from outside. Then you can get it inside. The instruments, equipment also you have to spray virucidal drugs on that and then take inside, so that you are trying to minimize the re-entry of the organisms. Because our disinfection is disinfection. We are removing the disinfection. But what are the ways to try to stop the re-entry of these infective organisms is biosecurity. So this protocol, if we follow, if at all you must go, then follow the protocol. Then there is no reason to worry.
Thank you, sir. Sir, someone is asking that how to differentiate between LPI and HPI.
See, basically, grossly, when the lesions are very severe, actually the photograph of trachea, what I showed you, was HPI only. Very dark red, completely soaked in blood, like a picture was there. So that type of picture is generally HPI. Now here what we see generally is not that type of picture. I don't know how many of the audience have seen that picture, but generally it's not that red what I have shown you. And then mortality in HPI is much, much higher as compared to LPI. LPI, there may be 5, 6, 10% mortality. HPI, it goes to more than 50%. So, but again, the confirmation cannot be done at the farm. It needs to be done at the laboratory, either by PCR or by virus isolation.
Okay, sir. In summarized way, someone is asking in ND outbreak, is it recommended to do ND vaccine at double dose?
Actually, ND outbreak, I recommend Lasota outbreaks, I'm telling, not general Lasota, I said no. If it is ND outbreak, not AI, then in many cases, to arrest mortality, people go for double dose of Lasota through drinking water. But if the mortality is very heavy, what I recommend is double dose injectable. So Lasota double dose in the outbreak can be given. It doesn't produce any antibodies. There is something called as interferons. They are formed and they will not allow the viruses to attach to your cells. They are not antibodies, because it will take at least 4 or 5 days with live vaccine also to produce antibodies. That cannot be done because the birds will completely, the flock will wipe out. So Lasota can be given in double dose provided the mortality is moderate. When the mortality is high, like 1%, 2% daily, then double dose of Lasota can be injected to the birds, either subcut or intramuscular. That gives control within 48 hours.
Sir, someone is asking that is there any disinfectant which is very effective against avian influenza virus, either through spray or drinking water?
Same thing I told you, na. Any disinfectant having triple salts of potassium, they are useful, because the very first I told you entrant was in 1994. Then it came from Antec International, and then it was Vircones. Now it changed hands with so many companies. Name is same. So that is the product which came first time with triple salt of potassium. And now Kem Raksha also, what we mentioned, is again same thing. So these products, provided you use them in proper dosage and proper method, will definitely reduce the viral load in the shed as well as in the birds. Only thing, as I told you, the spray, the dose of water, quantity of water, and complete covering of the area. That is very important.
So here again the same question. So I would like to highlight that yes, triple salt is effective against control of viral outbreaks, and you can prefer our Cambridge 49 for that. And I will share you the detailed literature as well. And there we recommended all the dosage of applications. So the sir, secondary, the another question from one of our audience is that, is there any role of paracetamol or aspirin in control of viral outbreaks?
No, basically paracetamol or aspirin, they are given to reduce the temperature of body. Paracetamol is same what we take when we get the fever. Maybe crocin, maybe dolo, maybe some other product, but they are all having paracetamol, and disprin is aspirin. So they are generally, this disprin is used for painkiller and paracetamol is for reducing the body temperature. Now, if the birds are having very high body temperature, then we can use it, but generally high temperature is not reported in AI. That may be in heat stroke or some other thing, but paracetamol will work in those types of situation. I don't think it will give any sizable or considerable results in outbreak of AI.
Sir, one question is very tricky, I think. He asked that if we restrict feed for 8 days, then mortality suddenly stops in case of HPI and LPI. Again, if we start feeding, then again the mortality starts. So what is the logic behind that?
Basically, this thing started in North India for controlling outbreaks of AI. Firstly, they were just restricting for 2-3 days, and then they extended to 5-6-7 days. And then it was definitely working. But again, these reports also, what you said, are coming, that the mortality drastically reduced. And once the feed started, again, the mortality increased. So in those such cases, you cannot do anything. I don't know what is the logic behind that. But that happens that when you start the feed, sometimes the mortality again starts shooting up. I don't have any reason for that.
Thank you, sir, and thank you for your insightful information. I just want to express my vote of thanks to you. This is, I think, your second webinar with
Yes.
Chembond,
First
and
was October 23.
yes, sir, yes, sir. And we are very happy that your communication actually very clear, and it's very knowledgeable as well. So it is my honor and privilege to deliver the vote of thanks on behalf of Chembond. And at the conclusion of this insightful session, first and foremost, I would like to express our heartfelt gratitude to you and for your valuable time and for sharing your deep expertise with us today. So your presentation, sir, on the importance of biosecurity protocols in poultry farming was not only informative, but also incredibly relevant to the challenges and responsibilities we face in the industry today. So you have clearly highlighted how critical biosecurity is, not just for disease prevention, but for safeguarding the economic sustainability of farms, ensuring food safety, and also promoting responsible farming practices. So I think your insights have certainly deepened our understanding and will inspire many of us to implement more effective measures on our own farms and facilities as well. Thank you once again for enlightening us with your knowledge and passion. We are truly grateful for your contribution, sir. Lastly, I would like to thank all the participants for your attention and engagement. Let us take forward the message from Rukadikar sir and work collectively toward a safer, healthier, and more secure poultry industry. Thank you, sir. Thank you so much.
Thank you, everybody. Bye.
Bye bye. And shortly, I will share this video recording.
Yes.
Yeah. So I will also share it on our company website, as well as personally also we can share on your mail IDs and WhatsApp numbers. Thank you,
Yes.
sir. Thank you so much.
Thank you. Bye.
So